Okay, so let's talk shortly about gynecomastia, which is enlargement of the breast, usually in males, which is not normal. It is considered benign, but something causes the breast of the male to enlarge. Usually, it's hormone related, namely the amount of estrogen increases usually as a result of decrease in testosterone, which are the androgens of the male. So, for example, things like using antihypertensive medications like spironolactone cause increase in estrogen levels, or things like liver disease. The liver should get the estrogen out, but when the liver is defect, it won't. Or things like pituitary disorders like prolactinoma, which reduce the levels of GnRH, LH, FSH, and therefore testosterone, and this increases the estrogen effect and therefore the enlargement of the breast in the male. So when we will see gynecomastia, what we will see is, as we can see in this mammography, you can see this uh, radiopaque area behind the nipple, which is the glandular tissue that should not be there in males. And this is the enlargement of glandular tissue in the breast. Also, ultrasound can be helpful. You see this hypoechoic area, usually again behind the nipple. This is the usual presentation of on ultrasound of gynecomastia. On CT, also you can see this hyperdense uh, tissue in the breast, glandular tissue. Of course, you can identify it. And here another mammography, you see behind the nipple, the gynecomastia of the male. Here is another ultrasound and another mammography. So you got the idea. Even on T2 MRI with fat suppression, you can see this enlargement of fibroglandular tissue behind the nipple in male. And this is the idea of gynecomastia in males. Maybe there is you can see the long list of differential diagnoses for gynecomastia, hormonal. Klinefelter can also be here. Drugs, you can see many drugs over here, even marijuana can be here. Systemic disorder, cirrhosis, we said because it's related to the liver mechanism. And it even can be idiopathic, namely, no reason is identified. Okay, now don't forget male breast cancer. But male breast cancer, fixed, painless, irregular, hard mass, remotely from the areola, usually gynecomastia is behind the areola, and Tetherine skin thickening can be in breast cancer. Okay, so this was about gynecomastia in males. Thank you very much. If there are any mistakes or corrections, please tell me. Thanks for Radiopedia, and thank you all, guys. That's it.